Previously on RN Info, last week's topic was diverticulosis. Just kidding, guys. Today, we're actually talking about diverticulitis. It's important to first understand diverticulosis before we can understand diverticulitis. And that's exactly what we're covering today. Welcome back to RN Info, the place where you get clear, reliable information on hot topics. If you've ever experienced this left lower abdominal pain alongside with fever and nausea, that could actually be diverticulitis. We're going to cover the symptoms, causes, possible complications, diagnosis, and treatment. And as usual, there'll be questions at the end, so stay tuned to see how much you've retained. Let's dive right in. So, what is diverticulitis? Diverticulitis is a complication that affects people who have diverticulosis. It is the inflammation of a diverticulum or multiple diverticula. Diverticulosis, again, which we covered in the previous video, refers to the presence of diverticula, the small pouches that form in the large intestine. These are usually asymptomatic, meaning they typically cause no symptoms, unlike diverticulitis, which does. If you haven't seen that video yet, be sure to check it out. Now, moving on to symptoms of diverticulitis. The most common symptom is pain, usually felt in the left lower abdomen, along with tenderness when the abdomen is touched. Other symptoms include nausea, fever, and changes in stool, which can show up as either diarrhea or constipation. Okay, moving on to causes and complications. Diverticulitis usually develops when there's a bacterial infection in those pouches or when the diverticular tissue becomes damaged. For complications, several complications can arise from diverticulitis. One is an abscess, which is a pocket of pus caused by bacterial infection. There's also intestinal obstruction, which happens when the swelling is carrying, narrowing, or blocking the colon. A fistula, which is an abnormal passageway that forms between the bowel and another organ, such as the small intestine, bladder, or vagina. Then we also have bleeding from ruptured blood vessels, which can then lead to anemia. There is also perforation, which is like a tear in the colon wall that lets its contents spill out. These can lead to peritonitis, an inflammation of the whole abdominal lining, and it is a medical emergency. Moving on to diagnosis and testing. Diagnosis typically starts with a physical exam where the provider reviews signs and symptoms, palpates the abdomen to check for pain, particularly in the left lower side. Blood tests may also be done along with urine and stool tests and liver enzyme tests to rule out liver disease. A CT scan can also be used to confirm inflamed diverticular and check for any of the complications mentioned earlier. Blood tests specifically help detect increased immune activity and infection, which can show up as elevated white blood cells and other inflammatory markers. Okay, for treatment. Treatment usually depends on how serious the condition is. For uncomplicated diverticulitis, those who worst symptoms are usually mild. Treatment can often happen at home with a liquid diet, a course of antibiotics, and pain relief such as acetaminophen. NSAIDs such as ibuprofen or naproxen should be avoided during this time. As symptoms improve, a solid diet can start gradually, but it's still important to follow up with a provider even if symptoms are mild. For complicated diverticulitis, those where symptoms are more severe and complications may be present. Hospital admissions and IV antibiotics are usually necessary, and surgery may also be required if complications develop. Okay, that brings us to the end of the main content. Now, let's move on to questions. First question: which abdominal region is most typically associated with pain in the diverticulitis flare? The answer is left lower abdomen. Second question: which complication is defined as a normal passageway forming between the bowel and another organ, such as the bladder? The answer is fistular. Last question. Which type of medication is specifically advised against while recovering from diverticulitis? The answer is NSAIDs. Okay, that's a wrap on this video. If you found this helpful, please like and subscribe and let me know in the comment section how many you got right, and I'll see you in the next one.